So this month now the children are back to school and it's getting a little bit cooler, and of course as a practice we're expecting a slightly higher demand for the emergency appointments with the flu season expected, and our younger patients starting nursery for the first time always get more coughs and colds. So we've done some planning around our appointments and being able to offer those emergency appointments for the flus that we're expecting. We've also had an infection control visit, which we passed, and we're relieved about that. And this morning I've been talking with our local CCG, and we're talking about how to implement the telephone consultations that we run at the Project Surgery and how to incorporate that into a project that's being run nationally called Primary Care at Home. And we all want to increase access for our patients because we know that patients still struggle sometimes to get an appointment, and I'm really excited about being able to teach other practices and share with other practices how we do the telephone consultations at the surgery. And we're going to be using the Plan, Do, Study, Act cycle, and I'm really excited about that because I've used it in the practice, and to be able to use it with the CCG and perhaps to improve access for 30,000 patients is really exciting for me. This month we've been looking at our patient online booking service, and we had quite a problem with patients complaining that they were waiting a long time on the telephone when they were trying to book a GP appointment. I tested this myself and I rang in at one of the peak times and I was 6th in the queue, so I can imagine how frustrating it must be for patients to be waiting. Although 90% of the appointments for GPs are available to book online, we were finding that only 5% of those were being actually booked online. So we couldn't work out quite why our online booking rates were so low, and we wanted to improve this using some of the learning that I'd learnt on the GP Improvement Leaders Programme. In order to increase our patient online booking uptake, I used the Plan, Do, Study, Act cycle. This is something I learnt at the General Practice Improvement Leaders Programme. With my team of receptionists and fellow clinicians, we had a look at the current uptake, and we decided that if we were to release the online appointments at 7 p.m. the night before, then this would decrease the telephone traffic occurring at 8 a.m. in the morning. We also wondered if it would actually reduce some hospital attendances, for example with mums with young children who might feel a bit reassured that they were guaranteed an appointment with the GP the next morning. It's going to go live later this month, and we will be changing our telephone system to promote this by having a voice message to encourage people to book online, and reception are also giving patients a lot of EMIS access logins to help them book online, and we'll be measuring the effects in the months to come. I was invited to Dogsthorpe Surgery, a practice in Peterborough that has a similar list size and patient population to my own, and I was invited to go and talk about telephone consultations because the practice wanted to increase their patient access to GP appointments, which they were currently having a bit of an issue with. The Project Surgery at the moment does undertake telephone consultations. It was a pleasure for me to go and visit them, and I really drew on my learning of the change model and the element being leadership by all. I spoke to the team of 10 people and was struck by one of the young receptionists who was really keen to try and make access better for patients, and it was obvious to me that it doesn't need to be one person or the most senior clinician in the team that's the leader. I was also struck by their shared purpose of trying to increase access, and that is another element of the change model, and they're now going to go for it, and they're going to be implementing the telephone consultations in the next month or so, and we'll be keeping in touch to buddy up and share our quality improvement stories together.